Hello, my name is Kim Bradley, and the article that I found is entitled Preference Assessment in Older Adults with Dementia. As cognitive impairment progresses, individuals with dementia gradually decline in activity engagement due to difficulties initiating leisure activities independently and effectively communicating their preferences. This includes such activities as gardening, knitting, golfing, and even crossword puzzles. Low activity engagement has negative implications for mood and quality of life. This can lead to depression and disengagement with friends and family. Preference assessments allows them to express themselves and giving them a medium of communication and participate in activities they will actually enjoy rather than just remaining dormant. Caregivers and long-term care staff are faced with the challenge of finding enjoyable objects or activities to engage individuals with dementia. This programming may be further complicated if preferred leisure activities have not been identified prior to the onset of cognitive decline. As a result, activity preference is often ascertained through caregiver reports when collateral information is available. However, the literature suggests that caregiver reports are imprecise and often inaccurate. This can lead to challenges and contribute to engagement in activities. To address this difficulty, preference assessments can be effectively used to determine an individual's likes or dislikes. The risk of developing most types of dementia increases with age, such that 5 to 8% of older adults, ages between 65 and 74, are impacted, and up to 25 to 50% of these are in the oldest old category, which is 85 and older. And they all experience cognitive impairment robust enough to impact their daily lives. The present study assessed the utility of preference assessment and the stability of preferences over time, that is 1 to 6 months after initial assessment. In a sample of older adults with dementia, average age 82.25 years with a standard deviation of 6.52 years, results supported the use of process assessment as an assessment procedure to assess preferences for items or leisure activities in adults with moderate to severe dementia. The majority of participants exhibited stable patterns of preference over 1 to 6 months, suggesting that preferences may remain stable for some individuals with dementia. In some way, this study provides further support to the utility of preference assessments and to the current understanding about the stability of preferences over time among older adults with dementia. The literature also suggests that preference assessments interventions that assist in preference behavior, problematic behavior, which is regards to agitation, and provides for activity engagement and subsequently increase the quality of life for this underserved population. Thank you.